Hello, I am Dr. Satarupa, working as a pediatric cardiac intensivist at Birla Heart Research Center. So today we are going to discuss about management of pediatric patients after cardiac surgery. So if a baby undergoes a cardiac surgery, immediately after the surgery is done, the baby will be shifted to our pediatric intensive care unit. So obviously there are some conditions which we need to take care. The baby has chances of bleeding. The baby has chances of the blood pressure going up and down. The baby has got chances of passing less urine. So obviously the baby will be coming in an intubated position where the baby will be put on a ventilator. There will be a lot of pain because the surgery will be very painful, and it is very difficult for small babies to bear that pain. So we need to optimize the pain control medicines, and we need to sedate the child properly, because if there will be a lot of lines, lot of drains, and it will be a very difficult condition for the child. Now on a ventilator, we will need to control the breathing of the patient, and with the help of the ventilator, which needs to be adjusted as per the oxygenation and as per the requirements of the patient. For the bleeding, there are high chances that the baby will bleed from chest, which we can detect from the drain output. There will be multiple drains which needs to be monitored how much the baby is bleeding, and if the baby bleeds more, then we need to support that with multiple blood product transfusion, and at times the surgeon needs to re-explore, and once again the baby needs to go to the operation theatre for re-exploration if the bleeding is not controlled. The next point is the blood pressure. The blood pressure is very important in this condition. Since there has been a cardiac surgery, obviously the heart will not be in a good state. There will be fall in blood pressure, and which needs to be addressed in the form of by giving IV fluids, by giving medicines which will maintain adequate blood pressure and the adequate perfusion to the vital organs of the body. The next thing is the urine output, which is also a very important indicator that needs to be monitored. If the urine output is low, then that does not means that baby is not doing well. We need to monitor that. We need to increase the IV fluid, or we need to increase the medicines which will increase the blood pressure, and obviously that will lead to an increase in urine output of the baby. The other important point is infection control. Since the baby will be having invasive lines and drains, we need to handle these lines properly and maintain proper hygiene when we are handling these lines, so that the baby is not affected, does not have any infection. At times we get this small kids with an open chest when the surgeon is not able to close the bone and the skin above the heart, because the heart is very down. So in that case, the chest will be kept open, only there will be a small sheet of plastic covering the heart. In that case, there is a high risk for infection, and these cases needs to be monitored very carefully in the ICU. And as soon as the baby's condition improves, the baby will be again taken in to the operation theatre for closing the chest. So once the heart recovers and the blood pressure improves, the urine output is good, the baby is usually removed from the ventilator and is woken up, the medicines are stopped, and the baby is allowed to wake up, and the baby is then thereafter, once stable, is shifted to the ward.